Well, hello, everybody out there. Welcome to our Raising Elevated Families here on our Elevate Chiropractic fan page. And I want to welcome everybody. And first and foremost, welcome here, Dr. Cara Riek, here with Arizona Breastfeeding Medicine and Wellness. So we are very, very fortunate to be able to have you on, and thank you for taking the time to do this, because with what Dr. Cara does here is so very important and is so, I don't know, you probably even say this too, upcoming more so and gaining more traction and understanding around this, which you'll obviously give us a little bit more insight into. But give you a little bit of just a quick overview of Dr. Cara. She's board certified family nurse practitioner. She's an IBCLC, which means, to those that don't know, international board certified lactation consultant. She's got a diplomat in American from the American Board of Laser Surgery, because we're going to talk about specifically what she does and focuses in on a lot of the educational and things. I mean, there's no short as far as expertise on this matter coming from you. And I know just from dealing with ourselves here in the office, from parents and new parents of little kiddos that really search out what you do, you're pretty much probably the top 1 to 3 providers that people go to that I hear about. And then, you know, we feel very comfortable directing people over to you that we see. And again, I don't diagnose these things. Just from, even if I have an inkling that someone might benefit, I send them right over to obviously the specialists that can do all that and help along the way. Because I find too that we've got like a little triangle of care providers that we deal with one, like yourself, revisionist, the lactation consultant, which you got that combined in through there. And then, we work on some of the structural and neurologic things to help these kiddos too. So it's this team approach to help these kiddos and these new parents, and especially mom, infant, to be able to have that thing, particularly, especially with breastfeeding. I know you have a passion around. So without ado, shutting me up a little bit more, I think it would be great to kind of understand a little bit more about yourself, your why, and how you've gotten to where you are right now.
Hi, thank you so much for having me. It's really a be here to kind of share what we do and talk about our collaborative approach, because it's so often that we to connect to each other to kind of tell patients, that connection that we really do have. Right. And so, I mean, for me, this process has been very much a personal journey. When I was younger, when you're growing up, you always say, I'm going to be this, or I'm going to be that. I was actually a high school math teacher, and I had no desire to go into healthcare at all. And when my son was born, the one thing that I knew for certain is that I wanted to breastfeed him. And that journey was the hardest journey of my life. And he got to be about 6 months old, and we persevered through a lot of different struggles. And I quit my job as a math teacher and I enrolled in nursing school. And when I enrolled, I said, I'm going to have a breastfeeding clinic so that I can help moms to feel good to have the support that I did not have. And I didn't know, this was 12 years ago, I had no idea what this looked like at all. And here we are. My son is 12 years, going to be 12 years old this year. And this practice and this kind of this learning process has really become like a labor of the heart, a labor of love, to help other mothers, to help other families, to provide what they feel is best for their family, to support them where they're at, to provide them the tools that they need to feed their babies, whether that be bottle or breast, and we aim for breastfeeding. But also know that this is a team approach. This is not just about you and your family, just you working with me or you working with Dr. T. This is all of us working together. It really takes a village to help families to bring, together to have that support to have that team approach.
Yeah, absolutely. You say that too. And especially, 12 years ago, I find, and this is from my experience too, especially in lactation consulting and these things, I think over even just the past decade, it's exploded as far as in the awareness of it, the accessibility, the understanding and the need for it. And especially with that intimate moment, particularly in life, is that feeding, right? Surrounded especially with breastfeeding and knowing and understanding the importance and the benefits of it, whether you choose to decide to breastfeed or not. But this is a lot with those moms that want to, and oftentimes it gets derailed for a number of different, obviously different reasons for most, but to be able to have that access for with number one, what you do, in particular with the lactation consultant community itself, it's a huge asset. And I found too, there's a wide degree of experience in that field too, from personally, as far as from my wife and I with our kiddos, from those that are, let's say in the hospital to those that are in private practice. And there's not one lactation consultant is the same across the board. That there's so much to do with the particular experience.
Well,
I know
that's true across the board for any profession, right? Like for you, neurological development, the whole body approach, and different chiropractors take different approaches. Different lactation consultants take different approaches. Different nurse practitioners take different approaches. Different release providers take different approaches. And it's just finding that person or finding that team that melds together for you, that answers the questions that resonate with you.
Absolutely. I couldn't agree more. Now, you started Arizona Breastfeeding Medicine and Wellness, and it's grown obviously with all the things that you've been providing. Now, in the office there, you provide a lot of different services overall. What are the general things that you guys provide over there?
Our primary focus is breastfeeding medicine, and so we try to work with moms and babies to help them feed babies in whatever way. So we deal with moms with oversupply and undersupply, and our other, the main specialty is really working with babies with tongue tie. Part of my son's journey is that it turned out that he was tongue tied, and that turned into my passion to help other families not experience or understand or learn more about what tongue tie is, lip tie, buckle ties, and releasing those the very best we can, and providing continuing support for families continue that feeding process. It's, and I always say to families, it's not just one little thing. It's so multifactorial that it's me as, release provider, the IBCLC, you as the chiropractor, the body worker, your family, your friends, that bring all this together.
Absolutely. And that whole learning to feed too, it's not just mom, right? It's not just like you moms out there, a lot of times they put so much pressure on themselves, right? It's baby, mom learning, it's finding what works for them. And then especially it's not the same for each kid too, right? Like it's a learning process.
Really a dance, and some of us get into this dance rhythm really good, and some of us start with 2 left feet, and it's really working to bring that relationship together so you have this beautiful dance. But dancing takes work, right? If you have to start off, and some of us start off better than others, and some of us have a knack for it, and some of us don't. And so it's really making sure that we kind of give you the tools that you need to work with practice makes progress, to kind of get to where we want to be, or where the family wants to be.
Yeah. The one area that I do want to kind of touch on with you, obviously with having you on here, and especially with a particular area that you see a lot of, is this whole world of lip tie, tongue tie, and we're seeing, whether it be we're seeing it more or we're just being more aware of it. But, I know a lot of our practice members have questions on this in particular, so I'd like to hone in on a little bit on this. So like a lip tie and a tongue tie, can you explain a little bit, real basically, what those are for our viewers?
So we don't have tissue in our mouth that kind of connects. So lip tie is underneath the upper lip here. Some of us have it underneath the lower lip here. Tongue tie is actually underneath the tongue, and it's how it's anchoring the tongue to the floor of the mouth. And so lip ties can affect things like how, if we're talking just about breastfeeding, how we're creating a seal onto the breast. So if you're really lip tied, you may have that lip curling under, and you may not be able to get a pretty good seal onto the breast. You may be ingesting a lot of air. You may not even be able to open very wide because of how that restriction is affecting you here, sometimes possibly here. Tongue tie is how it's attached to the mandible here, or to the lower jaw. And so if tie is really tied to the lower jaw, that tongue cannot work as an independent body. The tongue cannot start to move on its own. It works with the jaw. We know for breastfeeding that tongue, being an independent muscle, needs to work on its own, not work in conjunction with the jaw. So we start thinking about tie release when the tongue is not able to work independent of the jaw, and it takes it takes more than just a release, as it takes that body work, that strength, that tone to be able to bring this all together.
Create that balance. And then, what are some signs, let's say, for like a new parent out there, that there could be this going on with their little one?
So some of the things we see in the beginning is pain. Breastfeeding should not be painful. It may be uncomfortable, maybe in the beginning, but it should not be painful. Cracked, bleeding on nipples, blistering on the nipples for mom. A frustrated, sad, colicky baby. Feedings that are taking more than 20 minutes, especially after the first week or so, these like 40-minute, 50-minute, 2-hour feedings are a sign that baby's not actually extracting milk efficiently. Baby not gaining weight, low wet and dirty diapers, colic. I mean, I said colic is a diagnosis.
Mm-hmm.
Like no baby chooses to be upset and sad, so something has to be an underlying issue to create the sadness. GI issues. So we talk about like reflux, these babies that are spitting up often. Reflux is not really a diagnosis that young babies have, and there's usually a root cause that they're actually swallowing air. Sometimes it's allergies, sometimes it's protein sensitivity, but oftentimes that tongue is not allowing them, that jaws aren't allowing them to swallow correctly, and making their tummy upset and sleeping as well. So babies should be able to get, little chunks of sleep at a time. If this tongue is restricted, this airway is restricted, that's a sign that something is not right and needs to be addressed.
Right. And what would you suggest a new parent have their kiddo check for lip-tight, tongue-tight? I mean, do the pediatricians check for it? Should they bring them just to you just as a pre-screening, or should be more responsive if something's going on?
So if something's going on, I mean, definitely you can bring it up to your pediatrician. I say, unfortunately, we have amazing pediatricians, but they don't always have education in breastfeeding or in tongue. And so really your kind of first stop is working if you're having breastfeeding issues, feeding issues with an IBCLC. They're going to be your support team. They're going to be your system. They're going to be able to assess that tongue function, that lip function, and they're going to say, hey, maybe you need to go see and have a release provider. Hey, maybe you need to go see a body worker, a chiropractor, to kind of loosen up some tension in the muscles and decide next best steps. In our office, we have IBCLCs. I am a release provider, but there are other amazing IBCLCs in the Valley that you can go to create that connection to know where to go.
Yeah. And are there any other programs in your office? I mean, do you do any educational classes, anything online, anything out there?
We have support group. Every Friday we have support group. It's geared toward tongue-tied, but we also have breastfeeding moms that just come in. We do offer prenatal classes and prenatal screening. So if you want to come in before baby, just to meet us, to get to know us, you have questions. We really encourage that so that we can kind of get the ball rolling. Before baby gets here, we have a good game plan for what you want feeding to look like for your baby. We have partner classes that you can come in with your partner. We have, we're starting to get some rhythmic movement classes going, tummy time classes going, for moms to come in and work one-on-one with their babies, just to get the whole body moving.
Yeah.
Because you cannot push your baby enough, and that movement really helps to kind of loosen everything up and help babies and moms to feel better, help that connection to occur.
Absolutely. Now, I know you've dealt with a lot of moms and little babies, and this is, I just want to get your opinion and seeing what your experience is on this. But I see with a lot of the practice members that we see that are coming in for some of these kind of typical challenges early on, and I see such a repetition of this, and let me know if you see this as well. But if there's a traumatic, stressful labor delivery, interventions, whether they be forceps, vacuum, induction, C-section, are you seeing more of these challenges with those types of birth experiences?
Birth experience exacerbate ties, right?
Yep.
And so if you have a baby, because ties are formed in utero when baby's growing inside the tummy, if you have that and then all of a sudden you have to use a vacuum extraction, you have to do a C-section, that's just make things worse. I say, I kind of equate it to, think about a little sapling growing tree. Like if that sapling already is kind of bent to the side and then you already put another kink in it, you're just kind of adding insult to injury, right? So we need to work, one, to kind of help sticking out to undo that damage that, and not even really damage, but the result of the birth to kind of straighten things out, and then bring the tongue tie so that we can have a nice tree, nice child that's growing correctly, without any restrictions, without any tension, tightness, and whatnot, because we know that down the road that.
Absolutely, yeah. That's what we see too, because we deal with a lot of that stress effect on the nervous system, that stress effect on the structure itself. I was just interested to see if you saw that kind of trend and pattern as well that we're seeing here too. To kind of wrap this up, because we like to keep these kind of a lot of information real quick. But is there anything else that kind of crosses your mind you want the viewers to know about, things that you may have coming up, something just for them just to know about you or even around breastfeeding?
I guess the big thing we have coming up here in my office is we're actually having a tongue-tie course that's geared toward chiropractors, ABCLCs, dentists, pediatricians. So if there's anyone interested in the Valley to share with them, it's actually, unfortunately, for the Father's Day weekend, but it's a 2-day course. that we're having in my office. Dr. Marty Kaplan is a world-renowned dentist who's coming in to speak with me. Dr. Shelley Klein's a pediatrician. We have a really great group of people coming together. If anyone's interested, we'd love to have them here and to share our passion. The other thing I say, just a general blanket statement for families that are listening to this, just always follow your gut to follow your intuition. If you think something is off or wrong, find somebody who's willing to listen to you. It doesn't have to be me, but find somebody who resonates with you, who listens to you, who will understand your story, and who will help you get to the bottom of it. Because if you feel that something is wrong or off, chances are it is. And you just need to get the answers and find that answer to help you.
I love that you said that, because I try to tell people that all the time too, because I think when you lose that mama gut or that instinct or that parent gut, like that sense that we just feel something's off, but we may listen to some outside source and we just kind of go a different way. And always there's that internal, that innate kind of voice that talks to us, and I think we kind of hush it up too much. So I'm glad you kind of pointed out, especially during that crazy time for a new mom, especially for like a first-time mom. Like, it's just so consuming. There's so much going on that many times we just kind of forget about that, or we don't trust it and go along a different route. So I'm so glad you mentioned that too, here and with our viewers as well. What's a great way for people to be able to connect with you?
We have a website, so it's bfmedaz.com. You can also email me. It's Dr. Cara at bfmedaz.com. If you get a hold of our office phone numbers and my cell phone numbers on the website, so you can always, I'm open to text messages. So people saying, hey, this is what we have going on, or hey, we need to get an appointment to the office. I try to make myself pretty accessible. I realize feeding is not a 9-to-5 job. It's an all-the-time job. And so we're here for you morning and night to answer your questions, to provide you the support you need. And if I don't know, I'll find somebody who does. That's
awesome. Well, Dr. Cara, thank you so much for coming on, and thank you so much for what you do out there for our community. I appreciate it. And I'm sure there's a lot of people that would speak highly of you. I know I've heard many of them as well. So if I would definitely recommend, if there is anybody out there that's just unsure, it's great to connect and get that basic information to help you along this process that you're looking to help make it easier and more enjoyable and the way it should be overall. So thanks again, Dr. Cara, for coming on. And for everybody else out there, until next time, be elevated.
Bye.
Awesome. Thanks, Dr.